So the next thing that...
Dr. Ashish, can you please come to the chair?
The next topic that I'll be presenting is the role of immunomodulator in post-LASIK dry eye. So post-surgical dry eye is something which is an entity which is has become known now, and it's an important issue. It can be seen after LASIK, it can be seen after cataract surgery or any other surgery, and particularly somebody who is at risk of developing dry eye, he will have this component of post-surgical dry eye. We know that in LASIK we create a flap, so we cut the nerves, so there's reduced corneal sensation, and that's why there is reduced tear formation. And this is the neuronal loop, and if you make a flap, this signal to the brain does not go, it goes lesser, and that's how you have less tear secretion. It is more depressed in long-term contact lens wearers and preoperative dry eyes. Then as far as corneal reinnervation is concerned, the reinnervation of cornea occurs, near complete reinnervation occurs only after 4 to 5 years. But in 6 months to 1 year time, the corneal reinnervation is enough so that the patient does not have symptoms related to dry eye. Even after cataract surgery, patients do have dry eye because you create a corneal incision. Although it's of smaller size, but still you cut the nerves. Then these patients are also older, they have meibomian gland dysfunction. Some of these patients are females with menopausal, perimenopausal age group, and some may be having coexisting glaucoma with anti-glaucoma drugs. Then many times you want to reduce astigmatism, you make additional cuts. So all these things, they can reduce the nerves, and that can cause dryness. Even in glaucoma surgery, use of antimitotic agent can cause loss of limbal stem cells, it can cause ocular surface disorder. Even after retinal surgery, there can be risk of all these dry eye. And it has been seen that patients wherein silicone oil was used, the evidence of dry eye was more. So, coming to the management of dry eye, if any patient has a dry eye or you have done a LASIK, you would like to put the patient on artificial teardrop which is preservative free. And if the patient has a subtle evidence of inflammation, some sign of inflammation, or pre-existing dry eye, in such cases you would like to give anti-inflammatory drugs like topical steroid or topical cyclosporine. Now cyclosporine is an FDA approved therapy, and we have been using cyclosporine in dry eye. It's an established modality, there's no doubt about it. And there are various studies which have shown that in post-LASIK, if you use cyclosporine, the quality and quantity of vision is better. The recovery of vision is again faster, the quality of vision improves with use of cyclosporine. And that's what has been shown in most of the studies. So, again, cyclosporine is a good drug for post-LASIK dry eye, that's a known thing, or any patient who has a pre-existing dry eye. So what are the problems? Now, some of the patients on whom you will give cyclosporine, they complain of stinging and irritation and all that. That is basically because most of the formulations are oil-based and they have preservatives as well. Now, if you have if you have some preparation which is aqueous based, the patient will have less irritation. And if the preparation does not have a preservative, the patient will have less symptoms. And that is what has come up, no financial interest, but there is a preservative-free cyclosporine has come up, which is Cyclosis PF, and which has a pH value close to 7. So the patients have also used in some of the patients, and the irritation and the stinging is much lesser. The reason is this, that as I told you that the pH is 6.9 and that is very close to 7, which will give comfort to the patient. Then this preparation also has a Novelia multi-dose eyedropper. Now multi-dose drugs have the risk of contamination, and that is why preservatives are used. But if this system, Novelia system, has unique advantage that the drops which have fallen, they fell, and anything which has come out will not go back. So that is the advantage of Novelia system. So the risk of contamination is less. So cyclosporin has been shown to improve, provide qualitative and quantitative improvement in tear film. It increases goblet cell density, and thereby it is not a palliative drug, it's a disease modifying drug. And it is given twice daily in cases. So the question is that cyclosporin does require a long duration of treatment, not just by month or two you will not get a result. In 2 months time you will start getting some result, and it needs a long term therapy at least for 6 months, at least for 1 year, 2 years, even longer in some patients. So the point is that whether it is required in all the cases, so I would say no, because many of the cases they can be managed even without cyclosporin. But there are many huge subset of patients who will, if you examine carefully, they will have subtle signs of inflammation. Or those patients who had some predisposition of dry eye, or some patients who are more symptomatic. In all these patients, use of cyclosporin, topical cyclosporin is very effective. And if the cyclosporin is preservative free, and the pH is close to 7, then definitely the patient does not have a stinging or burning sensation as well. So that's the advantage of this drug. So thank you very much for your patient listening, and any point you would like to add or suggest.
Do we have any comment here, sir?
No, very nice presentation, Rajesh. Just wanted to know what is for the larger audience, what is the preferred choice of lubricant for post-LASIK patients?
That's the most difficult question on earth, actually. And but in a routine case, you can go for any drug, anything of your choice. Like you can use CMC, you can use polyethylene glycol, you can use HA, anything you want. Whichever, and there's one susceptibility also of every patient for each polymer. So that is also an issue. So you have to see that whether the patient is comfortable or not. If the patient is not comfortable, you can change. But if somebody who is having a pre-existing dry eye, if somebody who is who requires some volume, then in that case HA can be useful. Somebody who is not very comfortable with these CMCs, you can move to HA, or you can use to polyethylene glycol. So to tell you frankly, nobody can say that this polymer is the best polymer. It is best provided your patient is comfortable, provided you are comfortable with the use of that drug.
The use of cyclosporin, you said, I mean, you can use it for 6 months or even years.
Yeah,
together.
yeah.
Anything to keep in mind when you're using cyclosporin for years together, or 1 year, 2 years?
Nothing, absolutely nothing. We have used 2% cyclosporin for long, and in those cases also systemic absorption was much less. The concentration was less than 159 nanogram per ml of blood, and anything beyond that can have some adverse event, but even with 2% the blood concentration is absolutely safe. So this is 0.05 or 0.1%, whatever you are using, it is absolutely safe. Twice, see, normally we give twice a day. For therapeutic purposes, 4 times a day has also been used, 0.1%, 4 times a day. But normally we use 0.05% twice a day.
Even we are using cyclosporin in the allergic patients also, in the children also.
Yes.
For a longer period of time without any adverse effect.
In allergic patient, I would prefer going with 0.1% at slightly more higher concentration. For dry eye, 0.05 is good for any surface related, but for allergic patient, 0.1% is good. Yeah.